actually give us 1 minute. Great. Good evening. It is Thursday, April 27th, 2023. This is the North Andover Board of Health, and I officially call the meeting to order. We are going to begin with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. The first item on our agenda is new business, and we have the introduction of a new member tonight. We have Brawl Spite, who is joining us. Do you want to tell us a little bit about yourself?
I'll just thoroughly embarrass myself. Thank you, first of all, and thank everyone collectively in the community for trusting or entrusting me with this responsibility. I moved here 2 years ago from Chicago. Not born and raised in Chicago, but have been there over 20 years. I moved back, as they say, happy wife, happy life. My lovely wife, Sarah, we have 6 kids, 3 of which are living with us still. Rest of them have flown the nest. A member of St. Michael's. I'm very involved with NASA, which is why I'm dressed like this in soccer gear with my son and daughter's soccer sports. I always jokingly call myself a recovering engineer. Very passionate about science and science-related issues. I've started 3 separate businesses in my lifetime. I've been a public official as the Chief of Staff for the Public Building Commission. So I'm just excited to serve. So.
Thank you. Well,
I have
welcome.
a really important question. As a New Yorker, born and raised, actually Michelle too, what is better pizza, the Chicago deep dish or New York pizza?
Well, see, what I didn't tell you is my grandparents came through Ellis Island. So.
Okay. All right.
Yeah, so New York all the way.
All right.
You're on the right board.
Yeah, seriously.
Great. Well, welcome. We're glad to have you. Moving on to old business, we have the plastic bag restriction warrant article discussion. Brian?
Okay, so I think we've had 2 presentations already from the Sustainability Committee, so thank you very much for a 3rd time here. We appreciate it. I think as a board, you should definitely take a stance and either vote to support it or vote to not support it. As a department, we are in charge of implementing policy, but you as a Board of Health set the policy for us to implement. So you guys can discuss it. They're here tonight, Nancy Keith are here to answer any questions, or if you guys want to talk, by all means, you're more than welcome to say anything else you want to say, or add to any discussion. Please feel free, okay?
Yeah, we're primarily here to answer questions.
Okay, great. And Brawl has seen it, but he hasn't been able to participate yet, so he's here. And obviously he can give his 2 cents as much as he wants. So
Only to acknowledge that, thank you for the presentation. I actually was here, the previous time I was sitting in the back there, so I at least heard a fair amount of the board discussion. I tend to have sensitivities as a small business owner, and I understand what some of those impacts are, but I also understand the environmental impacts. So I think it's a difficult decision, and it's one that, is not to be undertaken lightly. It's really a combination of, what's the surrounding regime, how many other communities are in the area, and honestly, I'm not 100% aware of who has adopted it versus who hasn't adopted it. But it's in the right spirit of what they're trying to do, certainly. But past that, can't say I've necessarily, even at this late hour, made up my mind one way or the other, but certainly sensitive to the arguments. So.
Thank you.
I'll pass it to you, and you guys can start a discussion.
Sure. Yeah.
And ask any questions. If you have any department questions, obviously ask me. I'm here for that, for support. We'll go from there.
I know at the last meeting, we obviously heard from a local business, and you had also reached out to local businesses, and appreciate that you had sent over the letter from the Sierra Club, but just wondering, any progress with Merchants Association, anybody else in town for support? Like where are our local businesses standing on this right now?
I didn't take that up for
You can sit
just so they can
there,
hear
or
you,
can sit-
just somewhere near a microphone.
Nancy Sarro, 44 Equestrian Drive. Yeah, so we have talked to more businesses, even since we presented last time. It is a little bit of a mix. I think people, change is hard for some people. I think many times people would prefer not to change if they don't have to. There are businesses that are supportive. Some businesses we found aren't kind of willing to take a public stand. So they kind of quietly say to us that they don't have a major issue with it, but they aren't willing to publicly say that. I think as business owners, they perhaps, worry about, whichever side they fall, they might, anger a customer or shopper or whatever. So a lot of the smaller businesses that did have objections now fall below the 3,000 square feet. There are several businesses in town that already use exclusively paper bags, or almost all paper bags. So we've heard from some of those that they're fine with it, they're already using paper, but again, they don't want to publicly endorse. We did try to reach out to some businesses in Andover that have already made the change, and the first couple businesses we went to, they were already using paper bags for their takeout business. So it wasn't really a change for them, so we couldn't get them to endorse the change per se, because they're already using paper bags. So there are quite a few businesses that have already made this change, already made this shift. So we do have some, mitigating factors for businesses. We are able to obtain some reusable bags that we can give out to especially some of the businesses that perhaps are a little bit more concerned. We can reserve some bags to give to their customers, reusable bags. There are other options that businesses have that are concerned. So it is a little bit of a mix. I don't know if do you want to add anything, Keith, based on anything I missed?
Maybe just Stop and Shop and their major change.
Oh, yeah. Yeah, good one. So Stop and Shop actually is an interesting example there, and we haven't talked to a lot of the chains because we know they already do this in other towns. It's not a big deal for them, but just kind of interesting in terms of where businesses are going. Stop and Shop has made a decision that they're actually going to charge for all bags. So they're encouraging, and this is across all Stop and Shop, they're encouraging people to bring reusable bags to the extent where they're actually going to charge for any kind of disposable bag that's given out at the register.
So I'm a data guy as well. It says the letter from the Sierra Club, over the last decade, there's been 150 communities across the state. So what is the data and the studies that have been done thus far comparing towns that have done the plastic bag ban versus towns that have not done the plastic bag ban, and the impact of the environment in comparison to the two?
I'm not aware of any studies like that. I don't even know how you could do a study like that because there's so many variables in terms of the impacts. There's impacts for air quality if you're doing incineration. There's impacts for litter. I don't know how you can measure litter. Plastic bags either end up as litter, they end up as incineration, or they end up as, remind me what the third one is that we had in our slide.
Because I know
Oh, and a landfill, or the other one is that they end up people try to recycle them incorrectly. So they end up jamming up the recycling equipment if people put them in recycling, they're not supposed to be in recycling. So there's so many different, things that are negative about it that I don't know how you could pick one and do a study on it, but I'm not aware of any studies like that. Could be, but we just haven't found that.
Because I know Joe last meeting said that, which is actually news to me, that for the incinerating part of it, that we're actually generating energy, and how the Commonwealth of Massachusetts has certain set regulations already in place that impacts the amount that's actually coming out to the environment. So I don't know if that's necessarily a big key factor to all of that. I guess my other question is, and kind of going back to what I said last month, is that why the extreme of just going right for a ban and going back to the education piece? Look at Stop and Shop. Why not just ask other businesses, why don't you do the same thing? Charge whatever amount of money per plastic bag, and eventually you'll get more of a culture shift as opposed to just putting the hammer down and saying no plastic bag bans for anything greater than 3,000 square feet.
Yeah, so couple things. Can I respond to all of your comments?
Oh, yeah, of course.
Okay, one
Yeah.
second.
Yeah.
Read you something.
Yeah.
It's just short quote because you mentioned about the incinerator, so I kind of want to address that first. Well, first of all, I'd like to say that it really doesn't make sense in my mind to say that, well, the incinerator generates electricity, because that kind of implies that, hey, the more trash, the better, right? Because it's generating electricity. It doesn't make sense. Yes, it's good that it generates electricity as opposed to not generating electricity, but it's better not to have trash to begin with. So, oops, wrong paper. I just wanted to read you a couple quotes from the Mass DEP site. One is, and this is about incinerators. It's important to note, however, that no combination of technologies available today can completely eliminate emissions from combustion. So when there is combustion, there are emissions, and there's no technology that completely eliminates that. And another quick quote is, air emissions from a well-operated and maintained combustion facility are generally lower than the limits established by law. Pollution controls, monitoring, and government inspections ensure that facilities are operating as cleanly as possible. That does not mean clean, as cleanly as possible. At the same time, the emissions may still contain, and it lists a number of items, including dioxins, furans, and other chlorine-containing organics, which are known or suspected to cause cancer and birth defects. So yes, there are scrubbers. Yes, there is an effort to make it as clean as possible, but it's never entirely clean, these incinerator facilities. And as you saw from the Sierra Club letter, 9 million plastic bags per year from North Andover. Our estimate was 11 million. Okay, so there's some question about number of bags per person times the population, but it's 9 to 11 million plastic bags per year for North Andover going into this incinerator, or not being disposed of properly and going into either litter or into recycling incorrectly. And as far as like why we're taking this approach, 154 towns in Massachusetts have done this, representing, I forget the exact number, 65% of the population. So many, many towns have also done this, including many surrounding communities to us: Andover, Haverhill, Lowell, Reading, I believe. So it's very common, and unfortunately, people won't always change unless you force a change. And so Stop and Shop is opting to charge for bags. Other businesses can choose to do that, but we can't dictate that they have to charge for bags. And in lieu of charging for bags or having a restriction like this, many, many people will still use plastic bags because it's just easier. Does that answer your question? Or? Okay.
As far as enforcement, what is the budgetary cycle for the town? And if there was a desire to see if we could get resources to support this, what would that time frame look like?
We'd have a year to work on it, because this wouldn't go into effect until the beginning of 2024.
Okay.
So not a full year, but we'll have a time to work on that. Enforcement, if it's something that is passed, then we'll enforce it. Simple as that. Does it take time? Yes, but that's our job. That's what we do. So don't think of the enforcement as a problem. It's just add it to our daily routine. As it starts and then progresses through time, the enforcement and the time required will get less. Once everybody complies, even new businesses coming in may make a mistake and not know, and then order them, and then have them, and then we get a phone call to ride out, or a phone call back, talk to the store, the operator, and then they'll just adjust from there. Probably give them a time frame to use up their bags, and then once that order's through, then kind of give them their grace period, and then the next order they know, order paper. So enforcement wouldn't be a problem, just time.
Any other discussion, question? Go for
I
it.
had a couple questions. I know Chicago took more of a tax slash recovery effort with plastic bags as more of a market kind of driven solution, which is probably closer to my inclination. I don't know if you have any anecdotal references or experiences with some of that, and maybe it doesn't apply given the differences in community size. But I've heard a lot of good and bad, just having, lived through that experience when it converted over. A lot of it was an educational effort for sure. The second question I have, or maybe the second point I'm interested in understanding, 3,000 square feet is what % of businesses in North Andover that would be affected by this?
When they went from all food establishments that get a food permit down to over 3,000 square feet, it cut it down by 2/3.
Okay,
So all the small businesses that would probably have the biggest financial impact were now neglected from this particular restriction. So above 3,000 square feet, we have approximately 60, and we don't have a number yet because some of the square footage that we have is through the assessors, and if it's in a strip mall, they only
yeah, it's
have
tricky,
the
yeah,
entire building versus individual units.
yeah.
So once we fine tune it, we'll have a better number, but that will take some time.
It-
Can I comment on your?
Yeah, in one kind of related amendment to that 3,000 square feet, what % of the problem does that eliminate in your mind if you have the 3,000? I mean, obviously you chose that number.
Yeah, so to answer sorry, to go back to your first question
Yeah,
first about the
Chicago
fee, about the
experience,
fee.
sort of
By the way, I was
fee-based
just in Chicago this past weekend, so hearing the discuss, my son lives there, so it was interesting hearing all the discussion about Chicago. We had deep dish pizza while we were there.
Which is quite tasty, by the way, despite my preference for the New
And very
York style.
filling. So the reason we can't go with a fee, and I agree a fee would be a good way to go because then customers would be even more incented to bring a reusable bag if they had to pay a fee for either a plastic or a paper bag. In the state of Massachusetts, towns cannot impose a fee like that. So in the city of Boston, for example, they do that. They're considered a city, not a town. But in Massachusetts, as a town, it would have to go to the state legislature for approval. And some other towns have tried that, and they have not. It never rises to the top of the legislature voting on it because they get something like 7,000 bills a year that they consider. So that's why it didn't make sense to do a fee as a town. Regarding the 3,000, we picked that number because most of the towns that we looked at don't put any kind of a size threshold on, but the ones that do, 3,000 is a pretty common number. And that we haven't done the math on the percentages, but I know it will take some of the, help the health department. It does reduce the number by quite a bit. And because the larger stores would still be included, it would still be very impactful.
I guess the only, the engineer in me says if you went up by another 500 square feet, do you pick up, another X number of businesses to at least help them out while still focusing on the largest producers?
I have no idea.
Yeah, I'm being difficult. I'm just,
The threshold,
I was actually thinking.
Yeah.
I didn't use a range.
Like,
When I went through and counted, I just literally used 3,000 as my cutoff.
yeah,
And just plus or minus the whole thing. But it did cut down the number by a significant amount, going from everything down to 3,000 square feet. We do a lot of temporary food permits as well. The farmer's market, the artisan market, all the festivals, and we've got dozens of ones that come in for each one of those. So we had hundreds of those over the course of a year. So if we had to do that every single festival, it would take a lot of time. But
sure.
those pop-up tents and the food trucks are way less than 3,000 square feet, so.
Yeah. It is somewhat arbitrary, the 3,000, and we chose that mainly because that's what other towns seem to. And we also did we have a list of businesses that we looked at, even the ones we didn't talk to directly, we started looking at. We had a lot of lists we were going by, and we were kind of doing that kind of check too. It was like, does that seem like right number as you compare which businesses would fall over and which ones would fall under?
Yeah, I think when you use 3,000 as a number, it really differentiates between the small operation versus a big operation. Even a restaurant that's 2,000 square feet is fairly big.
Yeah.
But once you get past 3,000, you're a good-sized, substantial restaurant or supermarket or something like that. So it does actually, like Green Apple Cafe is 1,200 square feet or something. Tiny, small, owner-operated. You could have a bigger impact on them versus a TGI Fridays or something like that that's 3,500 or 4,000 square feet.
I basically felt this was a reasonable compromise.
If we got rid of like 2/3 of those businesses, aren't we just going back to using plastic again? That's my concern. If you're cutting out 2/3 of businesses, they
Well-
can all use plastic.
Yeah, sure, but it's kind of an 80-20 rule, right? So, you know, if you look at size versus number, it cut 2/3 of the number, but not 2/3 of the volume, because, you know, the large stores, think Stop and Shop, Kohl's, TJ Maxx, Market Basket, CVS, all those would still be included. So the larger places are still included.
Yeah, the larger places have a lot more customer foot traffic and purchases than a small local operation.
And to be honest, you know, something about the allowing some businesses still to have the plastic bags, you know, it does give the town and consumers a little bit of flexibility, because, you know, if they do want a few plastic bags for something, they still will have them, but they won't have like the large quantities. Like if you go to Market Basket and you see people shopping at Market Basket, it's a shopping cart full of plastic bags. Nobody uses all those plastic bags for anything, you know, but maybe they one or two, then they'll still have the option to do that. But we'll still be cutting it down dramatically.
Does the group have a multi-year plan? Like, is this phase one? Is there any talk of a phase two, phase three? Just curious, like, what you're all thinking.
And, you know, I can't make any guarantees that we won't, you know, think about other things going forward, but the group was formed explicitly for this issue, and we haven't had any conversations about doing anything else.
I mean, haven't towns gone as far as banning like plastic water bottles too?
I don't know about the water, yes, very few, I think, on the water
Okay.
bottles.
few,
I
yeah.
know Andover's was much more extensive, and they went after a lot of like the takeout containers.
Styrofoam.
They did. They takeout containers as well as
Yeah.
the plastic silverware for
Yeah.
takeout as well. They went after that as well.
Yeah,
But I recall some towns went after the plastic water bottles, which I think by weight is probably a lot more in terms of volume than the plastic bags. And I know that looking at the waste stream here in town, there's a lot of plastic in there. Not just the bags, but
Yeah.
everything else
yeah.
involved, and it all doesn't get recycled.
Would that include nips, the plastic nips?
Probably.
I know, right? Just wondering.
Yeah.
Did Boston did that?
I think
Yeah.
Boston's going
Yeah.
after that.
Yeah, I mean, I don't love, you know, of course, you can probably guess from from where my interest is, I don't love plastic water bottles either, and I always use a reusable water bottle, but we have no specific plans to do that, and at least the plastic, good for you, that's great, at least the plastic water bottles can be recycled.
Yeah. But yes,
In
so-
curbside, I should say. Yeah, they're easier because curbside will take them.
Yep. Thank you.
Any other questions? If not, discussion, thoughts?
I just think that it's a major change for a lot of people, and I think there's been so many changes in the past few years, just to add one more, and let everyone get a nice deep breath and get things back to normal before we start saying, no, you can't have plastic, and that's just my opinion.
I'm more in favor of the educational piece and bridging that gap as opposed to just a flat-out ban like this. Plus, now Steve being gone too, I mean, it'll take a little time, I'm sure we'll recruit somebody else, but,
Just advertise a position.
no, there you go, okay.
If
so-
anybody's looking for a job, call me.
There you go. I don't know if I can support it either.
We're all looking
Look
at you.
at you.
Just discussion. Yeah.
Tough choices. I'm probably more on the side, I guess, the thing in my head that I'm still trying to grapple with is the benefit versus the punitive nature for the small business owners and how that nets out. I think the consumers will always kind of figure it out at the end of the day, a reasonable solution. But ultimately, and often, it's going to be at the expense of the small business owners. Having said that, because it's at 3,000 square feet, my sense is, honestly, the ones that can quote-unquote afford it are somewhere in between that 3,000 and some number X. And so I'm trying to figure out where that number would be, where I'd be more comfortable. Because I feel like if we could selectively say, you know, the CVS's, the shop, you know, the larger vendors, make sure that those folks are minimizing their usage, if that's really the 80/20. You know, there's a lot of difficulties as a small business owner, and it's just my sympathies are always with small business owners and expenses they have to incur, which is why I prefer, if there was an option, it would always be more towards not a voluntary tax, but a tax or a market-based solution versus just an outright ban. And I'm saying a lot of words here, but I think where I am is I probably support something with a slightly larger square footage, and I could probably get there, but I'm a little bit leery at the 3,000 square feet, because it's 3,000 feet sounds big, but again, I'm wearing another one of my old hats. I used to be a real estate developer. That's still, depending on how you demise or how you count, you know, establishments, those are still some small businesses as well, and can be small businesses, where, you know, the margins are thin. You know, retailers, the margins are thin. Restaurants, the margins are thin. We're not talking about, you know, operations with a lot of margin for operation. If you put one more expense on top of that, what's the honest in what is the option? I guess the one other thing that I never got clarification on, I think I heard 150 businesses in Massachusetts. I guess the more relevant thing for me is between Essex County and kind of the immediate surroundings. It sounds like if we have Andover and ourselves in Haverhill, that's one axis, that's nice, but if there's communities immediately to the east or to the west of us that don't support that, I guess it's a question of, do we get any migration or issues around either business owners or the patrons of those businesses? And I don't want to hurt business owners. If it can't sound clear enough, I worry about small business owners.
Can I just comment on the
Absolutely.
surrounding towns? So most of the towns around us have this in both directions.
Okay.
Tewksbury is to the west of us. Newburyport is to the east of us. Haverhill is to the northeast of us. Andover is right next to us. The one town that doesn't have this is Lawrence, which is a city, and I don't think there's a lot of people that are, you know, going to leave North Andover to go into Lawrence to do their shopping. Maybe some, but I highly doubt that that's going to be an issue. So from a I hear what you're saying about the businesses, but I would say from a competitive standpoint, because the surrounding communities all have this, there should be no competitive disadvantage.
What about Boxford and Middleton, since they border us?
Well, Boxford has almost no retail, so I don't think Boxford would bother to do this.
Since I live out that way, I can.
What about Middleton?
Middleton
Because Newburyport doesn't border us.
doesn't border us, but it's pretty close. Middleton, I think Middleton does have it, but I'm not 100% sure about Middleton.
Reading? You said Reading?
Yeah,
North Reading?
Reading or North Reading, one of them has it. Yeah, I forget which one. So it is, you know, very common in the towns around us. The other thing, oh, sorry, go ahead.
And the 3,000 square feet does actually cut down the number of small businesses dramatically from the original proposal to incorporate that into it. Literally, we went from 300 down to like 60. So it is the bigger establishments that it would be affected by. The smaller ones, not so much.
The other thing is, I would just ask you, you know, of course, I understand that's a hard decision for you all, and I appreciate that. You know, definitely hearing some words of support for the concept, and maybe just some concerns about the size limit or whether it should be a mandate, not a mandate. But I guess I would ask you to consider, you know, this is the Board of Health. I would hope you would be evaluating this a little bit more on the health aspects of this. These plastic bags are made from fossil fuels. And this is having an impact on our climate and climate change. And, you know, you'll hear some young folks speaking at town meeting. Young people are extremely worried about the environment and climate change, to the point where some of them, my daughter's generation, are considering they don't even want to have children. So from a health perspective, the making of the plastics bags, the fossil fuels, the climate change, the incineration of bags, and the chemicals that puts into the air, I would hope that those would be the things that you would be, you know, would be more top of mind for you. But I get that it's a hard decision, but I would just ask you to more maybe think about the health aspects of this as the Board of Health.
I think Joe brought this up last month too, because he brought up the fossil fuels of burning for the trucks
Yeah.
that bring the plastic, the paper bags, and what goes into making a paper bag.
Yeah, stacks
as
and
well.
among other things.
Correct. So I don't know if I can buy the fossil fuel part for the plastic bags, because plastic bags would be just as much of a culprit as well.
Yeah, and so but some of the things that we've looked at, there is definitely more, there is some trade-off there, but it still, on balance, comes out in favor of eliminating the plastic bags. Because the paper bags are made out of recyclable materials. And also, we're going to do a lot to try to promote reusable bag usage. And I think, you start somewhere, and it does start to cause a culture shift over time. So if every single plastic bag was being replaced by a paper bag, that would be one thing. But that's not what we're hoping will happen, right? We're thinking that people will become more cognizant of this issue and start using the reusable bags more. And reusable bags hold more than paper bags, too. So, and plastic bags. So this is one step in the right direction. Is it the be-all and end-all? No, but it is a step in the right direction, as 154 towns in Massachusetts have made the same decision.
I go back to the education piece, because it sticks in my mind that, when you put a mandate down, people get resentful of these things. And there is not really a educational campaign about what's happening and what can we do instead of a ban. That's the part that just sticks in my mind. It was just like, let's go for the ban. That's it, as opposed to educating the community as to why plastic bags are, and yes, people can Google whatever they want, how much of it is fact and how much is fiction, is certainly out there. But as the town, as an organization, going out to the community, we have, community events throughout the course of the year, the farmers market, July 4th on the Common, just a couple of them off the top of my head, of just being able to educate people instead of just coming out and just making a flat-out ban. That part just kind of rubs me the wrong way.
Yeah, no, I understand. And let's not think of this as a zero-sum game, right? If we do this, it doesn't mean that we can't also do more education and steer people more toward the reusable bags as opposed to paper bags. So there's an opportunity here still to do the education, because if you think about on a spectrum, plastic bags are the worst. Paper bags aren't great either. Reusable bags are the best. So we're going toward that direction on that spectrum. And let's do some education and some campaigns for the reusable bags. And we do have reusable bags to give away. And I think even just the process of presenting at town meeting, that's going to raise visibility and steer more people more toward the reusable bags. So it doesn't have to be a zero-sum game of one versus the other.
There's a question behind you.
I have a question. I live in town. Would you be doing the educational part, or will?
Tony,
You have to go to the microphone. You have to go to the microphone.
And who are you?
Tony Wolfenden, 183 Green Street. Will you be doing the educational part with your committee, or will we be as the health department?
Which educational part are you talking about?
Because you're talking about trying to educate people.
Well, we're going to do some education as part of town meeting, right? We're going to have materials to hand out.
But more, we're talking about going out to, like, the 4th of July and sheep shearing and all that other things to try to promote less plastic, because we do have the incinerator and we see the trash trucks coming in from incredible amounts of towns and cities across Massachusetts and New Hampshire, Maine, and they're all coming in to North Andover to use the incinerator. So we're trying to teach people as opposed to hit them with, another thing that we have to do. And we are all very aware that we should be using the recyclable bags. I totally agree with that, but it's just one more thing that we're going to have to do. So once again, the educational part, will your committee be doing the educational part, or will we be doing the educational part as the Board of Health and the Health Department? And that's my question. Who's educating?
Yeah, so again, we're doing some of the education by coming to these meetings, by talking. These meetings are on public broadcast. we're going to town meeting, we're going to be talking about it at town meeting. So we're doing some of that education. Have we thought beyond that we're going to go to all the sheep sharing and all of that? No, we're trying to get to this point of getting this to pass. What I'm saying is we can all work toward education afterwards. That's not necessarily what we're working toward. We're working toward this, but if people feel like that's important for education to get people from paper bags to reusable bags, because ideally this will get them from plastic to a mix of paper and reusable, but to get toward more reusable, we can talk about that. I don't know what I can commit to right now by myself. I'm part of the team, but we can look at that. We can talk about that, and certainly by having reusable bags to hand out, which we will have some to hand out, that will be communicating and educating as well.
I guess my concern on the education part, and I totally hear you. I mean, from the health department perspective and the health, I hear it, and I definitely want to support a sustainable environment. But we just did a community health needs assessment. And,
In process, not finished.
well, no, but we did the assessment,
Yes.
we did the gathering of priorities from public. So we did multiple outreaches, and this did not come up as a top concern for North Andover.
Not in the top three.
Not in the top three. And so I support, like the concept, I'm just trying to figure out as a Board of Health, there are so many things that we can focus on. There's so many messages that we can give to the community about health, and just trying to figure out, I think our job is to prioritize them and to try to figure out what are the greatest issues for our community, where if we are going to sheep shearing, what is that one or two things? Because we can't talk about 20 things. Then we're not going to make any impact on our health. So I guess that's the perspective I'm coming on is, there are so many things for us to think about and prioritize. I think as a board, we just have to think about that.
Yeah, and we aren't asking the board
Yeah.
to do anything other than support this. So we're not trying to put extra work on your plate. Yes, there is a little bit more work for the health department, but I think you heard Brian say that with the 3,000 square foot, it's really going to be manageable. Am I exaggerating to say it will be manageable?
Everything's managed.
Everything's manageable. So again, it's really, we're not asking you to prioritize anything, not asking you to do anything, just asking you to support for the health of not only our town, but the broader community. The incinerator, it's not, and this is not all about the incinerator, but the incinerator is on the edge of town, so it's not just about our community, it's about the region. I don't know if anything you want to add, Keith, but.
Keith Connors, 4 Village Green Drive. Thanks for taking this up again and allowing us to come for the third time. That education piece, I think I've been involved now in 7 presentations. So since it's a lot of work, right, any of this initiative, we're just citizens who have families, who have children, who are looking at the future, who are seeing the climate change drastically, who are seeing their landscapes decimated by trash. This is a drop in the bucket. You're talking about a 99-cent bag, right? 5 bags to a store, reusable. People are still going to have bags given to them. They don't even have to bring in a usable bag. But the decrease that it will create is going to be impacting, and it's a small step, but it's a first step in a way of just living more healthily. As you think about this as a health board, it is impactful. It's about, we were just talking about, geez, what is that impact? You're cutting out 3,000, you're putting a threshold of 3,000 square feet. What about all those businesses you're not capturing? We were listening to you, we were listening to the businesses, and we were trying to really be sensitive to that impact. So we were moving towards a way of capturing the majority of them, of chain stores that are already used to this in 154 other towns that are doing this, so it's not impactful. They know this. Stop and Shop is already changing it across the region, New England region, because they know it's the right thing to do. They see the writing on the wall. We want to be part of that. So that education piece, I think I've done 7 presentations to large and small groups. I'll be at sheep shearing, to your point, with the Friends of North Andover Trails, but I'll be talking about this as well. I've already got a commitment of 400 reusable bags. You got a commitment of 400 reusable bags, because we want to make sure we're supporting the businesses. I'm hearing a lot of questions about businesses, and it's important. I'm glad. We really care about the businesses, too. That's why we've done the surveys. That's why we've had the conversations. That's why we've adjusted our amendment. But we're even more concerned about the health of our town. about the incineration of toxic plastic bags that are not biodegradable. Even when they break down, plastic, once created, is forever. Brown bags go back organically into the earth to nurture. And so, yeah, there's some production impact, but there's as much production, if not more, production impact of a plastic bag in the dirty process of the extraction of oil, of the chemicals and the oils that go into plastic bag production, in the transport of plastic bags. Yes, there's some in brown bags too, but what is the better alternative? This is the better alternative at this time, and let's all think about even ways we can do this better. But I really implore you to, the Board of Selectmen passed this favorably. They should be concerned about businesses. Of the 154 towns, no businesses moved to towns where there's no plastic bag ban because they thought it would be more fruitful. It's not all that impacting. It's hard to change at first. We'll work on the education piece, definitely. But I just hope you really think of it in that entire context of, geez, what's really best for this town? All the towns around us are doing it. Why wouldn't North Andover do it? And why wouldn't the Board of Health actually see it in that context of this is a healthy and right decision to do? So I hope you will. And really, we're so grateful for the opportunity just to talk about this. So thanks.
Any other further discussion or questions? So the ask on the table is,
Do we actually have to vote on it, or just?
I would like you guys to have some sort of position. You guys do set policy, so I think the town should have an opinion on the Board of Health as to whether you are in favor or not in favor. As a department, like I said, we implement the policies that you guys direct us to. So the implementation is manageable. Like I said, if it passes town meeting, it'll just be part of our working environment.
Of the ban right now, but that's,
are people feeling ready to vote? Or do you want to keep talking a little bit more?
I mean, I think we can vote.
Yeah.
I think we've talked about this quite a bit.
Okay.
I mean, I'm going to go with Jen. I had more regulation. I just think that, I don't think that there was proper education done. I just can't
Right.
support it.
and education comes before change.
Correct. And education makes change more.
Right, it's change theory, yep.
So Robert's rules, I think there needs to be a motion.
Well, I'm waiting, I was like, is anyone
Oh,
gonna
yeah,
make
the chair,
I
yeah,
know,
the chair
right?
can't make a.
Yeah, I can,
Make a motion. Motion, second, discussion,
yes.
vote, tally.
All right, I'll make a motion to discuss and tally.
Well, you're making a motion to not,
Oh, no.
to not support,
Okay,
to not support.
Okay.
I'll second.
Okay, discussion. Any other further discussion? No? Okay, then, we need a vote. All those in favor of the motion to not approve?
Aye.
Aye.
Aye. So we have a unanimous position. Do we want to add, so that is the vote carries. Does anyone want to add anything to the group for suggestions or anything?
I think if they, go ahead. Nope, go ahead.
Deference.
Nope, go ahead, please. I defer.
I think there's something there that we can try to work on. I think that I think where I'm most willing to be supportive of it is to the extent that we can have a proper carve-out and more directed towards who you indicated were the largest responsibility, the largest agents responsible for the majority of the issue, and in time to be able to work with the smaller folks to get a voluntary change going. So in my mind, I haven't fixed a number yet, but I think there is a number at which I would probably become supportive. I can't unfortunately give you what that number is today, but I'm generally sympathetic, and I don't want this negative vote to indicate that I would not entertain or think about some manner of trying to control plastic bags in the future.
I mean, I agree too. I use the reusable bags in Stop and Shop. I'm actually better at it than my wife is. But I just think that the bigger thing is going to be just the education portion of things. I mean, as a physician, I'm not just going to mandate somebody to take a medication. I'm going to educate them why is it beneficial to them, and it adds to medication adherence. So again, I go back to the medication, to the education, the education piece again. And I think if you guys came back with a plan about how to do that before a mandate goes into place, I'd definitely be more in support of that too. I mean,
I'm serious as a physician, would you also not want to mandate no smoking in airplanes? I mean, mandates are required sometimes, and
I think you have to go up to the microphone.
thank you for your time.
Thank you.
Thank you.
Thank you.
Thank you.
Yeah, thank you.
Sorry. Moving on with the agenda, we go to communications, announcements, and discussions. I see COVID-19 and whatever else you have, Brian.
So luckily, a very light agenda. We had 0 COVID cases for several days. We had a couple pop up, but it's been very, very quiet. We are still tracking, but it's almost non-existent. I think most people are doing home tests. They're not reporting them. They're not going to the mass testing sites anymore. So I think it's pretty much, and the vaccination rates are through the roof. They did just change some of the recommendations with vaccinations, and I'll let Carolyn discuss that for a brief moment.
So the state of emergency is going to end on May 11th, but we're still going to be offering the COVID-19 vaccine in our office. We do have the bivalent, which is the only one that we're using now. The monovalent is actually discontinued. So for now, if you've never gotten vaccinated, it's just 1 dose of the bivalent. If you have gotten vaccinated and it's been over, I believe, 2 months, you're able to get the bivalent. As soon as you get the bivalent, 1 dose of it, you are up to date on your vaccination. They did just approve for 65 and older and anybody immunocompromised to get a 2nd dose of the monovalent. No, not the monovalent. No one get the monovalent. Bivalent.
There you go.
But, so we do have that. We have Moderna. They're discontinuing the use of J&J. But for now, mostly everybody who has wanted to get a booster has gotten boosted and is up to date. That's it on COVID. We're participating in other things besides COVID, luckily. We're going to participate in a mental health fair at the high school that's hosted by the high school students.
Wow, that's awesome.
That's awesome.
We're also going to participate at the new senior center. They're hosting like a senior weekend, and we're doing something there. So we're moving past COVID and towards other things like mental health and blood pressures and sugar checks, which have fallen by the wayside during COVID.
That's great.
Awesome.
Thank you.
Thank you.
Aside from COVID, we are in the process of hiring a shared services coordinator for one of our grants. That is our Public Health Excellence Grant. That is a regional collaborative. We are also in the ending stages of our community health assessment, which Michelle has been graciously spending a lot of time on with me. That's in the final stages of getting a draft written and then finalized, and then we can start to look at implementation for that. We are in the market for a new health inspector. Stephen's last day was last Tuesday. He has moved on to greener pastures, so that was just advertised the other day on, I believe, MMA, and I think we're getting it onto Mass Health Officers Association, hopefully this week or early next week, and we can start collecting resumes and seeing if we get any applicants for that.
Do you have an interim solution? So
Yes.
spread the word wide.
Yes,
Far
yes.
and wide.
I am the interim solution.
Okay.
So, yeah, we'll just hunker down, and Tony's been a rock star helping out and helping me schedule everything and manage inspections and meetings and all that kind of fun stuff. That's it.
Great.
That is all I have for you this month.
There is nothing else on the agenda. Did anyone else have anything else?
Make a motion to adjourn?
Meeting is adjourned. Thank
Always